So good morning, everyone. I know folks are still joining us, so please feel free to take the opportunity to introduce yourselves in the chat, say hello. I'm going to dive into some quick housekeeping items and remarks, and then we'll get started. So my name is Maggie Dixon. I'm the Home Visiting Coordination Initiative, or HVCI, Development Coordinator, housed at Prevent Child Abuse New York. And we host monthly webinars, just an opportunity for conversation and learning. Today, we're so pleased to be joined by Michelle and Meg from Mental Health Association in New York State, and they're going to be talking to us about the Mental Health Community Partners model and approach. So we're really excited for this opportunity. Please remember that you can put questions in the chat box anytime. There will be opportunity for Q&A at the end. This session does have a live transcript option, so you'll see those audio subtitles at the bottom. And please remember to fill out a quick survey that we will be emailing to participants post-session. So without further ado, I'm going to hand it over to our speakers. Please remember you can chat us anytime with any questions, and looking forward to hearing you speak today.
Thank you so much, Maggie. Good morning. My name is Michelle Garcia, and I am the Assistant Director of the Mental Health Community Partners Program at the Mental Health Association in New York State, also known as Mahaney's. Just to do a quick introduction of myself, I am a peer trauma survivor. I am a supporter to young members of my family who live with mental health challenges, and I'm a second-generation Filipino American. I'm the first in my family to be born in the States, and I have a background in supporting BIPOC and immigrant families. And Meg, would you like to introduce yourself?
Yeah, good morning, everybody. Meg Spagnola. I am a former clinician in substance abuse treatment fields. I came to Mahaney's last year to support this kind of revolutionary model of treating folks in a non-clinical way involving their families. I really believe in this model after seeing some of the gaps in the treatment field. And so I'm excited to talk to all of you today.
Awesome. Thanks, Meg. So we're here to talk to all of you about how we've been supporting youth and family mental health through the Mahaney's Family Engagement Programming. So we started off with innovations in Mahaney's signature Care Path program, which is most defined by its relational whole family approach to mental health. But we'll be highlighting more today our new program, the Mental Health Community Partners Model, which takes that same relational whole family health approach in mental health and recovery, but specifically for supporting folks with a higher level of need as they're experiencing major life transitions. And so just to fully introduce our agency, we're the Mental Health Association in New York State. We're a non-for-profit that works through 26 affiliates throughout 50 counties. And we work to end the stigma surrounding mental illness and promote mental health and wellness across the lifespan. So we do this through a variety of training, education, advocacy, policy, and connecting individuals and families to support. And you may have heard of us, especially in recent years, because we have really risen to the spotlight due to the mental health education law. So in 2018, New York State became the first in the country to mandate that mental health education must be taught in all K through 12 schools. We were behind that legislatively, and then we were also behind implementation with the launch of the School Mental Health Resource and Training Center, where we provide technical assistance to schools and also resources to families with school-aged children. And now more recently, we're also again really rising to the spotlight for our work in family engagement. Again, the Care Path and Mental Health Community Partners programs. So I'll start off by sharing our program tagline, which is that our wellness is never in isolation of others. It's through partnership with others that we can actually find wellness. And so as we all know from our work with the youth and families that we support and from the loved ones in our own lives, we know that our relationships are everything, right? Our relationships, our family, they can make our wellness or they can break our wellness. And no one can achieve health, wellness, recovery entirely by themselves, right? We all need support, the support in our lives to show up as healthy as possible. So just think about that. In our own personal lives, who here during some of the most difficult times have wished that we had more support or better support? Who here is a supporter to a loved one, whether it's a child or an adult with mental health needs, and thinks back and wishes that they could have shown up as healthier supports to the ones that they love? And in our professional lives too, who here has supported a family where you thought, wow, the caregivers need just as much support as the child? So just a quick raise of hands of if any of those scenarios have ever applied to you. Let's see who, yeah. And so that's like almost everyone, right? That's most of us. Thank you. You can put your hands down. So this is what the Mental Health Community Partners Program aims to do. In our whole family mental health approach, we're really bringing together the person in recovery and their chosen supporters into one room. We're teaching everyone the same simple but powerful mental health messaging, which one, will support the youth or family member with mental health needs, and two, support the loved ones so that they can show up as their best supporters and they can have their own mental health supports, have their own needs met. And so, as I mentioned, Mental Health Community Partners was born out of Mahaney's Care Path program. So if you've heard of either before, what ties them together is that they both take that relational approach, extending support to both the person in recovery and their chosen supporters, and they function over a time-limited program, which we suggest as 90 days each. And so the two function together as a Tier 1, Tier 2 system programming. So as the Tier 1 program, Mental Health Community Partners supports youth and families with a higher level of need. So this is a program for youth age 12 plus or adult family members with significant mental health needs as they're experiencing stresses of any major life transition. So for example, that might be transitioning from a treatment setting to life with family back in the community, or simply transitioning in the recovery journey from being unwell to well. It's a time-limited program, so we suggest 90 days. And ultimately, the goal is to support the person in recovery to have a successful transition to life with family back in the community, and for the whole family, the whole support system to build a culture of health and wellness. Then, upon completion of those 90 days with the Mental Health Community Partners Program, the youth in recovery and their families then have access to the Tier 2 program, which is Care Path. And so this is when folks are in the community and they're eligible for an additional 90 days of support path. And so if you think of Mental Health Community Partners as building that foundation for recovery and a wellness mindset, Care Path then works to sustain that recovery and wellness mindset for healthy life out in the community. And really, Care Path is for any level of need. So whether folks have a mild, severe mental health needs, Care Path is for anyone. And now switching gears back over to our program of focus, Mental Health Community Partners. So as we mentioned, this supports youth with serious mental health challenges to support their successful transitions, whether it's from treatment to life back into the community, no matter what it may be. And we recognize that this transition is such a challenging one, right? Both for the youth in recovery and their loved ones. So we want to meet folks where they're at and provide reliable support throughout that transition. And as much as possible, when the youth in recovery is leaving a treatment facility, Mental Health Community Partners are meeting families and support systems pre-transition. So to help them get ready for that transition and provide that reliable support during that difficult time, helping them out pre-discharge. And just one of the goals of this program is honing in on the individual's motivation. So this program is fully person-centered in that every participant is able to define their own wellness goals, their own motivations, whether that is a teenager saying that their goal is to be able to enjoy playing soccer or play their PlayStation again with their friends, or a mom saying that her goal is to take care of herself so that she can take care of her kids. And it's the person in recovery who gets to pick their chosen supporters that will be taking part in this program. And they're the ones who get to define what recovery means to them. And as they're defining what's important to them, they're most bought into the program, right? They're most engaged, and they're placed in a very empowered role at a time when they very well may feel very disempowered. And by doing these things, they can be best supported by their mental health community partner and their family members, their chosen supporters, because then we're building a culture of communication where we can understand what really drives the person in sustaining their wellness and their recovery. And so now the mental health community partners model teaches and reiterates very few simple but powerful messages that leave long-lasting impacts on the participants that take on this journey. And so the first core teaching is that mental health is multidimensional, that there's many components that influence our health, right? It's not just our physical. You have your emotional health too. Your environment will also influence your health, as will your spirituality, etc. And secondly, the program teaches that recovery exists on a continuum of wellness, right? That just like your physical health, your mental health is always in movement. It's always changing day to day. It's ever static. And just because you have a diagnosis or you're receiving mental health support, it doesn't mean that you're going to be ill forever. It gives people hope that you can move towards wellness and recovery. And all of this program messaging is not only learned by the primary person with high mental health needs, but it's learned by family members and chosen supporters too. So we said that this program is really unique in that we're bringing together the person in recovery and their family or chosen supporters, right? And everyone is experiencing the same exact program. They're learning the same things about mental health, the same strategies about mind-body health, and that's really powerful, because a lot of times family members are not included in that conversation. And so when everyone is learning that mind-body health is similar for everyone, it reduces the stigma, right? So for the person in recovery, for that youth that's struggling with their mental health, the focus is off of them as being a perceived problem, right? It reduces that self-stigma. And for the chosen supporters, for the family members, they're finally getting their own mind-body needs met. They're getting their own caregiver needs and burnout addressed and supported as well. And more on that, let me just click through here. More on that, the family or the support system is offered numerous activities that's going to build on each other to support the whole family throughout these various stages of transition in a major life stress. And Meg will go dive deep into each of those activities shortly. And a core program is, it's the person in recovery that's empowered to select their chosen supporters, right? And again, this is really empowering in itself, because that person in recovery, especially if it's a child or a teenager, they might feel incredibly disempowered in their recovery as they're experiencing mental health challenges. And so by giving them the power to say, I would really like one of my parents that I really trust, a sibling, a cousin, an aunt, uncle, a classmate, my friends, an adult that they trust, anyone that they trust and is important to them, to invite them into the program, to learn all of these things together. That's really empowering for them. And this program, it does require a level of introspection, communication, and self-advocacy skills. So we do require all participants to be at least 12 years old. But even if the children that you support are below the age of 12, that's okay. Keep in mind that this whole family system, keep in mind the whole family system of those that you're supporting, right? So MHCP may be an appropriate tool for family members above age 12 that are supporting that youth that you have in mind. And also MHCP, it can also be a support tool for yourself as a professional. Meg will share later just a couple of testimonials that our trainees, our professionals, what they have said about how the training ended up supporting their own mental health and wellness. Because again, we want all of the mental health community partners to practice what they're preaching, practice everything that they end up teaching to families. So it's a great workforce wellness and self-care. And as we mentioned, this is a time-limited program, right? There's flexibility. So if you know that a family might need less than 90 days, more than 90 days, there's also flexibility in choosing how you want to support them. but it is very structured, right? Due to the high needs of a family during really difficult periods of transitions, mental health community partners meet very regularly with their participants. So we recommend doing weekly visits to the family to do the activities that we provide and to check in as to how they're doing during this transitional time. And again, Meg will share more about what those activities look like. And we're meeting folks where they're at. So whether participants best prefer in-person, online, a hybrid visit, as long as the mental health community partner is able to accommodate, they're more than welcome to do so. Furthermore, I also just really want to take some time to acknowledge that the Mental Health Community Partners Program has the ability to support diverse families. So the mental health field, as it currently is very Western, Eurocentric, has that individualistic bias, right? And that's because historic oppression, marginalization of people of color and immigrants has prevented us from becoming leaders, researchers, clinicians that shape mental health, quote, expertise, right? And therefore the consumers that can utilize those services. And that very individualistic perspective in mental health care is one of the things that makes many families of color and immigrant families so incredibly hesitant to seek mental health support, because it just doesn't speak to our values. It just doesn't make sense to us, right? And I've really experienced that myself in my own mental health journey and my family's. But what Mental Health Community Partners does is we're taking a relational approach to mental health, right? The whole family approach, the collectivistic approach. And that tends to align way closer to the values of families of color, immigrant families. And this makes this kind of program just much more approachable to our communities. And keeping in mind that many historically marginalized families and communities have historical medical trauma too, many of us, we fear mental health services, right? Because we know that the mental health system, or lack thereof, in past generations or in home countries have not always been caring for us. And so we really fear formal clinical services, right? But Mental Health Community Partners is a non-clinical program. It's a lot less scary for families of color to engage in. And MHCP also has a really strong emphasis on unlearning stigma in its many forms, whether that's self-stigma, family stigma, cultural stigma. And of course, in communities of color, where mental health education has not always been an opportunity, this is an incredibly valuable way to increase mental health literacy in our families. And this program, right from the beginning, also starts off with including some activities that speak to culture and identity. So we have some activities that explore, what is your identity? What's your culture? How has that influenced how you think, feel, behave, right? How does it influence your mental health? And what are the parts of your culture that can be leveraged as self-care to support your mental health? So again, just always incorporating the culture and being more person-centered in that way. So now we're going to introduce you to some of the fun things, some of the core frameworks that guide the Mental Health Community Partners Program. And we'll even get into some of the activities that the participants will be doing as well. So our first key framework is the continuum of wellness. So as you can see, this includes stages of wellness, illness, and absolutely everything in between. And understanding this process of recovery as including all of these different stages between wellness and illness also really provides realistic expectations about the process of recovery. So since participants are learning that a development of symptoms can be very typical in the recovery process, they're normalizing it, right? They're not feeling like a failure when symptoms inevitably return. They're gaining an awareness of how do I identify my symptoms when they do return, right? How do I ask for support? And in that way, they're learning all of these ways to spend less time in illness, right? And move closer to wellness. And that's what's most important, that they're building this self-awareness. And what that does is it provides participants with hope, right? The hope that they can always take steps to move towards wellness. And the Mental Health Community Partners Program was really designed through and through with the continuum in mind. So every single program activity was built to support participants at every stage of recovery, whether they're at a certain stage during their time in the program, or so that when they leave, they have the tools no matter where they end up at. So, for example, when a participant is developing symptoms, we're taking their wellness temperature, we're encouraging early recognition and support, we're connecting to care. When a participant inevitably becomes ill, which is perfectly fine, right? We're offering options, supports, connections to the community, and a mental health crisis plan to help them in moving back towards wellness. When they're involved in treatment and utilizing wellness tools, we're giving them voice and choice. So we're supporting them through mindful practices. We're equipping them with more specific support tools that work for them. And when they're in recovery, we're providing ongoing engagement, teaching them about principles of recovery, utilizing a step-by-step crisis plan. And even when they have achieved wellness, we're supporting them through a mind-body health maintenance plan, providing self-management tools and mindful practices so that they can sustain wellness as much as they can. And all of these things in the continuum, they provide a comprehensive approach in managing recovery. So from learning the continuum and engaging in all of these exercises, what they're doing is building the skills that they need in order to continue moving towards wellness. They're learning realistic expectations, right? That progress is nonlinear and that it's okay, and that symptoms might accompany recovery. And they're learning mindful activities to build awareness of their mind-body needs, how to recognize the symptoms, and how to recognize them earlier, and how to get the support that they need earlier. So again, being more proactive in their recovery and their mental health journey. And they're learning self-advocacy skills and self-sufficiency skills, right? So that when they do have needs, they're able to find support from the family, from the community, rather than turning to the hospital, the ER. And overall, of course, this all supports a reduction of stress and a rise to crises. And so now one of the fun parts, and this is a quicker activity, but let's do one of the quick core activities from the program together, which is the Continuum of Wellness Status Check. So just take a moment to kind of identify where you're at right now. So based on how you're feeling, how your morning is going, how life is going, which one of these stages would you say that you are at on the continuum today? So you might be at wellness, development of symptoms, illness, treatment, use of wellness tools, or recovery. And so just as an example for myself, I would say that I'm at treatment, use of wellness tools today. I've been feeling a little bit tired and overstimulated just from travel, work, but I was fortunately just able to recognize the symptoms of becoming unwell a little earlier than I typically do. And so I've been a lot more mindful to give myself more time to rest, prioritizing healthy time by myself, time with my family, time at home, doing my daily practices of gratitude, which greatly support my spirituality. And that has really helped me to move closer to wellness rather than illness. So I'm kind of at that self-care, which is use of wellness tools. So it's really quick. Again, just take a moment to kind of self-assess where you're at. And just so that, we can kind of see where everyone else is, I'm going to launch this quick poll and just take a moment to mark where you think you might be. I'll give it another moment and take your time. Again, no matter where you're at, it's completely fine. It's just a self-assessment, and there's always ways to move towards wellness. All right, thanks all for participating. Looks like that's just about everyone. So I'm going to end and share. So that's great. I'm really glad to be in such a healthy group. It seems like a lot of us are at treatment or use of wellness tools, meaning, we've got stress, right? But we're taking care of ourselves. A lot of folks are at wellness. And yeah, we can see that some folks are at illness or at development of symptoms or recovery, and that's okay. No matter where we're at, the point here is that, we're getting into this practice of self-awareness, right? Checking in with ourselves, with our loved ones, the families we support. And that provides a basis for, where do we go from here? How do we manage how things are today? And from there, a mental health community partner, after doing this exercise with a family, after checking in with them, might be able to assess, okay, I've got all of these self-care tools, all of these activities that a family might want to utilize. Where do we go from here? So again, just a really great assessment tool, a really great check-in tool that we use in our program. Thank you all for sharing. And I will hand this over to Meg to walk us through the next key portion of the program.
Thanks, Michelle. So, as important as the continuum is, we also are focusing on the 8 dimensions of wellness. And these two things play in together really well. And so Mental Health Community Partners uses the 8 dimensions of wellness to address the social determinants of health. Through looking at all of our 8 dimensions, we provide this holistic lens of what it means to be truly well. And this also helps to reinforce that mind-body health connection. And through doing that, reducing the stigma associated with mental health conditions. And so the 8 dimensions of wellness help us to frame the activities that are included moving through the 90 days or the 12 weeks, or however it is that you split it up. The 8 dimensions help us to guide participants through the rest of the activities. We explore what is having an influence on our health, right? What's having an influence on our recovery process? And then ultimately, what's influencing our movement along the continuum? And so a primary activity done in the Mental Health Community Partners program is a weekly score of each of these dimensions of the 8 dimensions of wellness. And through doing this, we get an overall wellness temperature. And the temperature allows us to find this earlier recognition of what influences our health, right? What influences our temperature reading. And by doing this every week, it really shapes that framework that we're in a different place every day, every week. Everything is always changing. And there's an opportunity to address the factors that are maybe negatively influencing our health. But even more importantly than that, it gives us the opportunity to take a look at what's strengthening our health and how can we leverage those components that are strengthening us to help us to continue towards that wellness stage. And so when we move through the program, having this comprehensive understanding of what health means, what wellness means to mom, to dad, to the person in recovery, it gives everyone that opportunity to take a look at their wellness and really understand that it's important for everybody. And that brings everybody on a level playing field when they're entering this program. And so we're going to do another activity. Like I said, this is an activity that's done every week, every time you meet with somebody as a mental health community partner. And so I want to focus today on the strengthening aspects. So I'm going to send folks into some breakout rooms. And I just want you to consider, before we do that, what dimensions are supporting your wellness? And so take a look at all 8 dimensions and consider as many as possible that are strengthening your current wellness, right? What supports you in maintaining wellness? Which aspects of your wellness contribute to successful self-care? And so take a look at this 8 dimensions of wellness image for a moment. And then I just want to send you out into some breakout rooms to have a chance to discuss with each other what supports you. What dimensions of your wellness do you utilize to support yourself? So I'll give you a moment to take a look at this. The dimensions, for those of you who are maybe just listening in and don't see this, are physical, spiritual, social, intellectual, emotional, occupational, environmental, and financial. So again, just take a moment and then please join your breakout room and just discuss with each other what dimensions of your wellness are supporting you.
If you're having difficulty joining a breakout room, you can let us know in the chat. Otherwise, we'll see you back here in 5 minutes.
Looks like there's at least a couple folks in each room, so.
Yeah.
I have a participant that I just got a notification that has asked for help in a room, so I'm going to quickly join that.
Oh, okay. Thanks so much, Maggie.
Thank you, Maggie.
I received a notification that a participant in this room has asked for help.
Welcome back, everyone. We're going to give it another 30 seconds or so for everybody to come back. I hope you guys had an opportunity to have a nice chat with some of your peers. We were just talking as you guys were in your breakout rooms of the simplicity of this activity and how it gives such an opportunity for us to take a deep look at something that we often maybe overlook as important. And I think that that's one of the keys here in this program is taking a look at something that we might at times overlook because we assume that we're taking care of it. All right, looks like everyone is back. Like I said, I hope you guys enjoyed that activity. I know for myself that my social and emotional aspects of my wellness are supporting me right now. You're fine, Michelle. And, I think at times, those move around, right? At times my social wellness is lacking, right? Maybe there's a time where I've been working remotely for longer than typical and I don't have that interaction with coworkers. And so, I recently took a trip with Michelle down to the city, right? Had some interaction. And so my social components are supporting me right now. And so I just wanted to highlight how quickly that can change and how we really use this to keep track and to pay attention week to week, knowing that these things change frequently. And the more aware we are of what's supporting our wellness, the better able we are to incorporate those self-care strategies that will bring us closer to wellness. And so moving on to some of the skill building activities that Michelle had mentioned earlier. So you guys just learned 2 of them, right? The Continuum of Wellness Status Check and the 8 Dimensions of Wellness Temperature Check. And so the activities in the program and in the workbook are a little bit more complex than what we just did, but that's the general idea of those continuum and 8 dimensions. We're doing that every week. And we're really highlighting it as one of the most important aspects of the program. The third core activity that we didn't cover is something called the family guidelines. And so family guidelines give us an opportunity to level set as a group, whether that be the community partner and the person in recovery, or the community partner and the person's chosen family, right? But it gives us this place to start off from, to talk about what effective and healthy communication looks like, and especially what it looks like when folks are in a crisis state or in a transition period, because we know how difficult conversation and communication is at that point. And so these are really simple activities, right? You saw how simple they are, but they're impactful and they're repetitive for a reason, right? We're doing this every week because we want to teach folks a new language to talk about wellness, right? To talk about mental health. And we want to, as best we can, reverse the stigma and reverse years of learned dialogue around what mental health is and what wellness is. So consider how long some folks in the treatment world have been spoken to or spoken down to, right? They've been hearing these stigmatized beliefs, sometimes for years and years. And so it takes this kind of repetitive, simple messaging to reverse some of those beliefs and change the way that they think about their health and wellness. And so you've seen the core activities, but on this slide are the rest of the activities that are given to participants and their families for the 90 days. And we split it up into 3 sections, and it's not a prescribed set of activities. And so we want to be aware of everyone's different readiness for some of these activities. And so we know that some folks might need to take this slow, and some folks might be ready to jump in as soon as they start. And so it's really up to the participant, the primary person in recovery, to make this choice about what they're ready for. But we have the activities there if they're ready. And so I'll highlight a couple of them. Michelle mentioned the culture, identity, and wellness, right? This is in the beginning because we know it's an important framework for the rest of the program. We start in the beginning as well with a self-compassion activity, right? This is really important in early recovery or an early transition period to understand how important it is to be kind to ourselves. And that third activity is one of my favorites, how support shows up for you. I just will highlight this to give an idea of how simplistic but meaningful these activities are. How support shows up for you is a worksheet that gives participants an idea of what support truly is. The biggest, or one of the biggest components of mental health community partners, is expanding the definition of support. And so typically we might think of support only as dad showing up for us financially or mom showing up by bringing us to an appointment. But we really highlight that support comes in a lot of different ways. It can come by a hug or a friendly text, somebody checking in on you if they haven't seen you in a while. Maybe it's somebody that is recommending a healthy food for you to eat that might impact your mood, right? All of these are ways that we receive support that if we highlight that, it makes us feel more supported. And similarly to that is, how does support show up in yourself, right? How are you supporting yourself? Maybe you're doing that by taking a nap when you feel extra tired or making sure that you're hydrated, right? But these are all forms of support. And so going through the rest of the activities, I won't read them all, but through the mid and end program, we start to dive a little bit deeper into some of these skills based on the continuum of wellness and the 8 dimensions of wellness. And so we use the emotional safety plan as an opportunity for folks to be proactive about supporting their emotional wellness. We use a map of community connections for folks to identify where in their own community can they go if they need support, and really highlighting the fact that there's a lot of support out there, right? But we need to recognize what is going to work for us. And lastly, Michelle had mentioned that mind-body health maintenance plan, right? We know that once we get to wellness, it requires maintenance and attention to stay there as long as we possibly can. And so we're supporting folks in understanding, which dimensions of their wellness do they need to pay attention to in order to stay in that wellness stage. And so all of these activities, like I said, completely up to the person in recovery when they're ready to do them, if they're ready to do them. But they have these in a workbook themselves. And so this gives folks an opportunity at home, or whether they're in a session with you, to dive a little bit deeper as when they're ready to look at their wellness. And so we hope to see some of these outcomes, if not all of these outcomes, through the implementation of the Mental Health Community Partners Program. First, we hope to see folks have an increase of knowledge in their mental health as multidimensional, right? We want folks to understand the process of recovery on that continuum. We want folks to believe and have hope that even if they're ill, then they have the skills to return to wellness. We want folks to be able to identify and use these self-management tools, these wellness strategies, depending on where they're at on the continuum. And this involves that furthered awareness of being able to see, where am I? Am I moving in the direction I want to? And if I'm not, what support do I have out there to move me in the direction that I'm looking to go? Outcome 3 is to strengthen the individual's own agency for maintaining their wellness in the community, right? We want folks to feel confident that they have the skills, that they have the support that they need in order to stay well in the community. And like I mentioned earlier, we're expanding that definition of support. And so we also want to raise the expectation of the support system. We want folks to know where they can turn and who they can turn to in order to stay well. We'd also love to successfully transition folks from the treatment facility, from a different stage of wellness, back to the community, right? We want folks to be in a place where they're comfortable. And so through the pre-discharge component of Mental Health Community Partners, we're getting folks ready for that transition. And finally, we hope to reduce readmissions and reduce unnecessary emergency room visits. So looking to that support system, looking to those self-management tools, and utilizing those to avoid unnecessary hospitalizations. So Mental Health Community Partners is a community, right? It's a small program, and it's offering an opportunity not only for folks who are joining the program, but as a professional development opportunity and as a skill that you can bring back to your agency. And so you've seen the outline of the program, right? It's something that you can use in a lot of positions probably that you're currently in. And so we see this as an addition to what you're already doing in your position. We see this as a skill and as a tool for you to bring back to your organization, and a model that you can use to support the clients, participants that you already are serving. And so ultimately, Mental Health Community Partners is supporting workforce wellness, right? We want to use this model not only to shift the way that participants look at their wellness, but shift the culture of the workforce. And I'll share in a little while, like Michelle mentioned earlier, some of these training testimonials that give this idea of supporting wellness through the training, right? We want folks to feel comfortable in this model. We want them to model the behaviors that we're expecting through the program. And so we're going to continue this messaging of a wellness mindset. We're going to continue the messaging of hope. And hopefully that's done throughout the organization, throughout the agency that you bring this program back to. And so these testimonials are from folks who have utilized the program. So these aren't the training testimonials, but program testimonials. And so I'll read through these. A family in Schenectady wrote, when my husband and I agreed to participate in Mahaney's Care Path program, we were interested in supporting our son in his recovery. We had no idea how the Care Path program would support our own health and our other children. Our family is grateful for the Care Path program. And so this is where we see that whole family component, right? You enter a program looking to do anything you can for your loved one, and hopefully exit the program gaining something for yourself. a case manager using the CarePath program from the Mental Health Association in Fulton and Montgomery counties credits CarePath coach training for enhancing engagement with individuals and families in recovery. And finally, Robert, a CarePath coach from Westchester County, said CarePath is a family-centered with a holistic wellness lens that is strengths-based, trauma-informed, and delivered within a structured system that can be evaluated for its efficacy. Right, so we're taking a look at these structured programs and how being structured helps folks to feel comfortable and confident in using these tools. And so hopefully these program testimonials from CarePath shed some light on how important and effective and meaningful mental health community partners can be for you, yourself, and for your agency. And so we'll shift to talking about the training a little bit, right? So a certified mental health community partner is expected and positioned to successfully engage the individual, that primary person in recovery, and their family members, right? And by doing that, we'll also strengthen their relationship to the community. And so if you choose to attend the training, there are a number of learning objectives, a number of modules that we use to help you to successfully be a certified mental health community partner and to engage these folks and their families. And so we'll cover things like person-centered planning. We'll really get in depth about the 8 dimensions of wellness and the continuum of wellness, right? We'll talk about some deep listening skills and motivational interviewing practices, really get into depth on cultural and social assessments and the impact of culture on person-centered planning. We talked about that self-compassion activity earlier. This is one of my favorites in the training, and I think a lot of others as well. It allows us some time to think about ourselves as human beings, right? And how we can be kinder to ourselves. And finally, we get into traumatic stress, right? How does trauma impact folks, the way that they show up? How does it impact their history of treatment, right? And their beliefs and their feelings about what treatment and programming looks like? And how can we shift the way that folks think of mental health treatment? And so the certification itself will be 21 hours in person. So this is 3 full days of training, or online we'll do 15 hours and then some self-directed learning assignments offline. And so you can expect a half-day training Monday through Friday and a couple assignments to take home and to review the next day. And so once you're certified and you've completed this 21 hours, you'll have access to all of our programming materials through our new website, which allows access to a portal, right? You'll be able to take a look at these marketing slides so you can bring this back to your agency and really let them know what you're bringing to the table, right? You'll also have the benefit of 20 renewable clock hours for certain professions, including CASACs, youth peer advocates, family peer advocates, certified peer specialists, etc. And so we really want to highlight how much of an opportunity this is for you for professional development, as well as for the community that you serve. And once you complete the certification, you don't just have a certification and then leave. We really pride ourselves on being available as a program for technical assistance. And so we've started monthly webinars, right? We're calling them Friday Forums. It's an opportunity for folks to get together who are trained in this model and the CarePath model and problem solve. Talk about what's working, talk about what's not working. Ask questions, right? And hopefully get together and share some success stories, right? And we are creating a community. And so that's what I want to highlight, is that once you complete this program, you're not on your own. We're here to support you. You're here as a part of our network. And we're looking to create this network of folks who are focused and believe in the family engagement model. So like I mentioned, there's a lot of benefits to becoming a certified mental health community partner. And it doesn't end at just having a program, right? Over the next year and a half, we'll be training over 480 specialized providers as mental health community partners. So we'll have a huge network of folks who hopefully are coming together and sharing their stories. You'll have the Friday forums for assistance in networking, right? To build your community, to find one of my favorite phrases, your people, right? We're a group of folks who are committed and dedicated to this work. We'll have an opportunity to list your program site on our website as a directory of mental health community partners. And you'll have an invitation to our Family Engagement Summit. And so we'll get together hopefully in an in-person venue where we can all meet. We can do some continued professional development. We can have an opportunity to hear success stories from folks in the community who've used this model. Hopefully get some speakers, right, who can share on the front line of what the most up-to-date family engagement styles are, right? And we'll really get together and share in that finding your people, finding your community. Another benefit is that folks who are trained as mental health community partners during this period of time will receive future renewal of their certification at no cost. And so this training, which typically would be $2,000 per person, will be free at the time of training, and then your renewal will be free as well. And so finally, folks who are trained as mental health community partners will then have access to become trained Mahaney's Care Path coaches through a reduced hour training. And so we won't have that 20-hour full week training because there's a lot of crossover in this program. And so you have the opportunity to become trained as a Mahaney's Care Path coach through reduced hours. And then you have that chance to work with a family for a full 6 months. And so we've been talking about the training testimonials, and this is just a chance for us to share some of the work that we've done over the summer and how we've supported the workforce as well as the population of folks that we serve. And so some training testimonials from over the summer include a registered nurse who stated that Mahaney's Care Path training built a new awareness of how to support my own health and well-being. Charles, a peer support specialist from New York City, commented that Mahaney's Care Path has changed the way I think about self-care. I now understand how the practice of self-compassion provides self-care. And finally, a coach from Brooklyn shared, I really enjoyed the training. Both facilitators were knowledgeable and presented the information in an easy to understand way to conceptualize what it means to be a Care Path coach. I definitely recommend this training to people who want to be a supportive coach to someone in their life or community. And I really just want to highlight here that this training, I know we've said it quite a few times today, but I truly believe in the support that this training provides to you as a professional and as a human being. And the reason why I chose to leave clinical practice and come to this program to do this training and to do this work with Mahaney's is because I really believe that there's alternative ways for folks to get the help that they need. And I think that anything that can do that while also supporting you and the workforce, which is, you know, a struggle at times, right? It's difficult for us to be compassionate and then also self-compassionate, right? And so I really want to highlight how important this has been for a lot of folks.
And lastly, I know we're just right up at our time just about, so we'll leave this just as a parting prompt for you to think about. Based on what we shared about mental health community partners, just think about, how do you envision the MHCP program potentially supporting youth and families that you support? So whether that's professionally, the youth and families that you are already working with, new youth or families that you could bring in to your agency with this program model, or even just in your own life, right? Because we all have our own relationships too. We all want to be healthy supporters to our loved ones. Is there anything from this program that you can take away to become a healthier supporter to your loved ones as well? And so with that, we'll wrap up. Just to reiterate some of our key points, again, the Mental Health Community Partners Program supports those with serious mental health needs during major life transitions. We pride ourselves in taking this whole person relational approach and whole family health approach to recovery and mind-body health. Of course, we're supporting folks in successful transition to the community, and that includes reducing those ER visits and rehospitalizations. We are also supporting the well-being of staff, including partners, and also individuals in recovery and all those chosen supporters all alike. And again, this relational approach, this whole family approach really is leading the next generation of behavioral health solutions. And with that, I'm also just going to leave this up on the screen as we wrap up so that you know where to contact us. So I saw someone already dropped in the chat, where and when are these free trainings? So if you go onto our website, mhcommunitypartners.org, you can find more information. If you look on the events page, you'll see we have a list of our free online training dates. If you do any type of work with this type of population, so anyone with a high mental health need going through those major life transitions, we're currently collecting applications to become a partner site. So if your agency would like to integrate this into your work, you can just submit the application, just submit 2 sentences about how you think you would integrate this into your work. And from there, we can enroll you in those free online trainings. And if you have any questions, of course, just feel free to reach out to us. And so, Maggie, I apologize. I know we're right at time. Do we have time for, if people are interested in asking questions, to stay on, or, but regardless, we have our contact info up here for anyone who'd like to contact us.
Absolutely. I will say, if you do have to jump off, I know we're at the hour mark, please feel free to do so and go ahead and email Michelle and Meg, but we have time if you'd like to stay on and ask a couple questions live. I do want to just quickly mention before folks hop off, I mentioned briefly at the beginning of this session that we'll be sending a survey out post webinar today and resources from today's session. I neglected to mention that the HVCI is a project of the Preschool Development Birth Through 5 grant, which is a federal grant. So that survey will ensure that we can continue these webinar opportunities, and is also going to give really valuable feedback to our presenters today. And keep an eye out for that email, because it will have resources and information about how you can access today's recording. So if anybody'd like to unmute or write in the chat, there's space for that now. And I just want to say quickly, thank you very much, Michelle and Meg. This was not only super informative, but it was actually a little bit empowering. I think it was Meg that said, this gives us language to talk about wellness and mental health. And I'm leaving today with so much knowledge, and I feel energized.
Wonderful. Thank you so
Maggie.
much, Maggie. Yeah, we loved being here. Thank you so much to you and to Jen for the invitation. And it was lovely to be a part of your group. So thank you all. And for those of you who have to leave,